Domestic and family violence is one of the most pervasive forms of violence in Australia. Lifeline is committed to providing support to people experiencing domestic and family violence by ensuring their access to quality and appropriate support and referral services through DValert, Domestic Violence Response Training.
The DValert program has been designed to actually upskill and give anybody who's working in the medical or allied professions skills to be able to recognise domestic violence and family violence in all its forms, to be able to respond to that in really appropriate ways, and then to be able to refer on in, again, really appropriate ways for the survivors of domestic family violence.
DValert is the only nationally run, accredited training program on domestic and family violence. It is designed to improve skills of health and other support workers to recognise the signs of domestic and family violence, respond with appropriate care, and refer to quality support services. DValert is available to all health, allied health, and other support workers in Australia. Supported and funded by the Department of Families, Housing, Community Services and Indigenous Affairs, DValert is available at no cost and even provides financial assistance that supports costs for travel, accommodation and staff backfill. DValert reaches a wide range of participants and is delivered across all Australian states and territories by Lifeline's certified trainers. DValert is delivered as face-to-face workshops or an online course.
Every opportunity I have to be involved with DValert, whether that be through the online learning or whether that be through actually facilitating face-to-face workshops, I'm never failed to be amazed at the strength of such amazing, passionate, dedicated workers. And again, workers that, once given the skills, are able to do such amazing work in their communities. So I'll always be grateful for these opportunities because we are so lucky that we have amazing people in the community to be able to support any survivor going through domestic and family violence and getting them the help that they need to begin that healing process.
The diversity of participants in the programs is important. For starters, it's a great networking opportunity. And so the participants are educating each other on interventions and perhaps referral services. And it's also an experience for them where they can start seeing that a whole range of workers are dealing with this issue. So it's not just within their particular profession. So it's breaking down the workers' isolation as well. The feedback we get is that it's given them confidence. And no matter how skilled, we've had doctors, psychologists, social workers, nurses, youth workers, and all of them have reported that they've learnt something that they didn't know and have felt far more confident in working in the community.
The face-to-face workshop is a 2-day course involving group activities and discussions, easy-to-use workbooks, and the assessment of skills and knowledge on completing the course. The course enables participants to broaden their understanding of domestic violence and hone and develop their skills to appropriately respond to these cases.
The Lifeline Domestic Violence course was an amazing experience. I learnt a lot of information about the cycles of domestic violence, and now I can take that information and apply it to my clients.
I think it gives a better understanding of what the services are available, what domestic violence is actually all about, and it gives you more confidence in referring on to other services that are available.
At a DValert, I guess just a better understanding overall about the processes that are in place, what works and what doesn't work, how to better assist people who have been victims but also perpetrators of domestic violence.
DValert is also available as an 18-hour online course which can be completed over a 6 to 8 week period. Participants work through lessons and complete assessment questions with a DValert assessor who provides support and feedback throughout the course. Upon completing the DValert course, participants receive a nationally recognised Certificate of Attainment to recognise and respond appropriately to domestic and family violence. The course accounts for relative units and qualifications in community services and accounts for points for continuous professional development for nurses and other health and support workers.
I think everybody would benefit from the training. Every individual, not just in the community sector, in other sectors of the community as well.
So I highly recommend a class like this for people who have been involved in domestic violence and people who haven't.
I would recommend this training to all the services so that they can be more aware and how to deal with the domestic violence.
Very beneficial. You know, one of the things is with your networking, it's is knowing what other people and what other states and you know, what other communities have been doing and that what they've tried and what's been successful for them.
It's always good to have phone numbers and people in the community that you know and you trust, you've spoken to, you've connected with here and you've networked with, that you can actually refer people onto.
For more information on DV Alert, visit www.dvalert.org.au or call us at 02 6215 9418.